Good morning, everyone, and thank you for your attendance at this event. Let's go to the first slide, please. All right. So Michigan has the 23rd highest number of cases among states in the nation and the 14th highest number of deaths. We also have the 34th highest hospitalization rate as a percentage of total beds in the state that are being used to treat COVID-19 patients. Our case rate per million people is currently at 287, 288. That's an increase of 21 cases per million from what we described last week. This rate we are considering to have plateaued for the third week in a row. Our percent positivity is now at 7.6%, which has gone down 2.2% from what we shared last week. And we are seeing increases in testing rates across the state. So that's been important in terms of getting a better understanding of our percent positivity. 10.7% of inpatient beds in the state are being used to treat patients with COVID-19. That's down 1.4% from last week. It's very encouraging. Between January 3rd and January 9th, there were 480 deaths reported to us related to COVID-19. That's a reduction of 55 over the comparator week prior. I mentioned before that our daily diagnostic tests are increasing. We're now at an average of over 41,000 tests per day, and that's up more than 7,000 tests over the previous week. We have reported more than 500,000 COVID-19 vaccine doses as of 1/19/21. And that's an increase of over 216,000 doses from the prior week's report. We're going to have a couple of science updates for you today about the B.1.1.7 variant, which is, you've heard already, has been detected now in Michigan, as well as understanding a little bit more about herd immunity thresholds and what that means for vaccination timing. Next slide, please. So first, let's look across the states. Many thanks to Michigan Medicine for gathering these data for us. We're currently seeing that 5 states are having increasing case trends. This is down from 38 states last week. So a lot of the nation is starting to see a downtrend. There are still 46 states with significant outbreaks based on cases, positivity, and/or hospitalization rates. In terms of the Midwest, Wisconsin is showing a slight drop in hospitalizations, a moderate drop in cases. Indiana is showing a slight decline in hospitalizations and a drop in cases. Illinois, Ohio, also seeing a decline in hospitalizations and varying levels of declining cases. And in Michigan, we're continuing to show a decline in hospitalizations and a decline or plateau in case rates. Next slide, please. COVID-19, our percent positivity has declined to 7.6%. 7 MERC regions are now below 10% for positivity. And those 7 regions are also showing a decline in positivity over the previous week. Our case rates have now plateaued. You'll see in a minute that the CDC case trend indicator is showing declines for most of the MERC regions, or all of the MERC regions. This indicator is based on a slope, which is very sensitive to small declines. So although I'm very encouraged to see that cases are not increasing in the state, right now we're considering this to be a plateau that we're monitoring. This plateau is seen among most age groups, race and ethnic groups. The one exception to this is the 0 to 29 age group. We may be seeing an increase in that group. In terms of the number of active outbreaks that local health departments report to us each week, we're seeing a 12% reduction over last week. And the number of reported school outbreaks decreased this week to 40. We're at 50 last week. The only setting where we saw an increase in the number of outbreaks local health departments were working with were in the high school setting. So let's go into the detail on these. Next slide, please. So this is what we fondly call the postage stamp. If you look at the bottom of the second deep purple column, you'll see our case per million rate for the state as a whole at 287. One region, the Jackson-Merck region, is over 400 cases per million. We have 4 Merck regions that are over 300 cases per million: Grand Rapids, Kalamazoo, Saginaw, and Lansing. The CDC trend indicator is showing declines. As I mentioned before, this indicator will be triggered by slight negative decline patterns what we are viewing when we look at the trend over time, which I'll show you in just a minute, is that we're really in a plateau state right now. However, I'm very encouraged that we do not appear to be seeing an increase after the holiday period. So on the whole, this is an encouraging picture. Our percent positivity in all Merck regions but one is below 10%, another encouraging sign. Our testing numbers have increased over last week in most regions, and our hospitalization percentage there, the 10.7%, as well as our mortality rates are also declining. So on the whole, a lot of encouraging news on this slide here. Next slide, please. So here are the positivity, cases per million, and daily hospitalization rate over time for the last couple of months. So looking at positivity and daily hospitalizations, the top and bottom graphic on the left-hand side, we can see positivity declining nicely and hospitalizations declining not as rapidly as they were before, but still on the downward trend. The daily cases per million, just a reminder that the gray bar on that middle graphic there is indicating where data are not yet stable or final in order to be able to interpret. So the encouraging signs I see on this daily cases per million graphic is that we have had this long decline since the end of November, beginning of December. However, since around Christmas Day, that decline has really plateaued, and we see that line has flattened out there. So we're eagerly watching this line every day to see if we'll start to have more of a decline in the future. Next slide, please. So this is looking at percent positivity by geography, in this case, county. One of the quick things you can see in this graphic, comparing the smaller map to the larger map, is that we have less deep purple on the map than we did last week. 21 out of 83 counties in the state have percent positivity of 10% or more. That's down 25 counties from the week prior. So it'd be very important that people continue to get tested for COVID-19. If we don't have adequate testing, our percent positivity will rise even if our case numbers remain the same. So it's important that people do access testing if they've been exposed, or if they are feeling ill, or if they're part of a surveillance testing program. Next slide, please. This is providing information on the number of cases we report out each day for lab confirmed cases. These cases are placed based on when we found out about them. So this is before we've interviewed people to be able to find out when they may have become ill. The number of weekly reported cases is remaining about the same or declining most recently. And in the last week, we had about over 14,000 cases reported to public health. Lab confirmed cases. Next slide, please. These two graphics are giving you cumulative and daily case rates by the date of onset of symptoms. So a couple things to take away from the right-hand graphic is that we've had a decline, but now you can see a little bit clearly here how the plateau is occurring. Our current statewide daily case rate remains more than 1.5 times what it was, what our risk level of E, that 150 cases per million. However, we are not seeing an increase at this time. Next slide, please. This is looking at those case rates per million by age group. The 30 to 49 year age group, which is the top blue line there, continues to have the highest case rates per million. One thing I did want to, you may notice that the line comes down and then you see sort of it almost looks like a check mark. That is Christmas Day. So the number of cases that are reported to us that have onset of symptoms on Christmas Day, there was a decline there. The 0 to 29 age group, after that period of time, seems to be increasing. You can see the black line there at the bottom. Whereas the other groups, they had a bit of a rebound immediately after that date, but then had a fairly steady plateau at that point. So we're going to continue to monitor the 0 to 29 age group. Next slide, please. So it's providing case rates per million people by racial group. Cases per million continue to plateau for most racial groups after that decline from the winter. 30% of cases are not represented on this time graphic, because either their race is unknown, it's listed as multiple race, or their racial group that is not included on this graphic here. The next slide provides information looking at Hispanic Latino ethnicity. Cases per million are plateauing for both Hispanic Latino and non-Hispanic Latino groups. Next slide, please. This is giving you the information about the number of outbreak investigations that local health reports they are aware of or working on each week. This is for the week ending January 14th. The total number of active outbreaks reported by local health is down 12% from the previous week. We're at 902 total outbreaks, with 128 being new. Following long-term care facilities, the greatest number of new outbreaks reported were in the manufacturing construction setting, which is a very large grouping, retail, healthcare, religious service, and social gatherings, both of which had 9 new outbreaks reported, and then K through 12 schools. Local health departments reported new outbreaks in all settings except for agricultural food processing, shelters, and outdoor community exposure settings. The next slide provides information on the number of outbreaks that are being tracked in K through 12 schools by local health. The number of school reported outbreaks decreased from 50 last week to 40 this week, including reductions in the middle junior high school, pre-K elementary, and administrative groupings. The high school grouping saw an increase in the number of reported outbreaks from 10 to 12 outbreaks. Next slide, please. So moving into examining COVID-19 and healthcare capacity, as well as mortality. Hospitalizations, what you're going to see in this next set of slides is that hospitalizations and ICU utilization for COVID-19 is decreasing. You'll see that in data from emergency departments as well as inpatients. Hospitalizations are down 52% from the December 1st peak, and ICU occupancy has declined 7% over the last week. Our current number of deaths has declined for the 4th consecutive week. So next slide is providing information about the percentage of emergency department visits that are related to COVID-19. So if we move to the next slide, please. Thank you. So either there was a complaint of COVID-like symptoms in the ER or a diagnosis of COVID-19 in the emergency room. And you can see the purple line is giving you that percentage of ED visits for COVID-like illness. You can see that's remaining below 4%. Next slide, please. This week, the total COVID-19 COVID-19 positive census in hospitals in the state is down to 1,908. This is a decline of 12% from the previous week and down 52% from our December peak. Next slide. These hospitalization trends are fairly consistent across the different preparedness regions in the state. Most are showing decreasing or flat COVID hospital census. Regions 7 and 8 are up slightly this week, but the total volume hospitalized in these regions still remains very low. Next slide provides information on ICU COVID census. The census of COVID-19 patients in the ICU has declined over the past week by 7%. Regions 2 North, 7 and 8 did see some increases in ICU census this week, although the total census in the regions 7 and 8 remains low. And there are no preparedness regions in the state that report greater than 20% of ICU beds being occupied by COVID-19 patients. Next slide moves into looking at COVID-19 mortality. These are presented by date of death. So the number of deaths have declined for 4 weeks. You can see that on the right-hand graphic, a nice steady decline there. The current number of deaths each week is more than 5 times the number that we were seeing in early October. Next slide, please. This is providing information for you on the number of deaths per million people by age group. The 80+ group still has the highest number of deaths, followed by 70 to 79-year-olds. Next slide, please. In terms of deaths per million people by race, we continue to see declines among all racial groups. White residents continue to have the most reported deaths per capita. And we are seeing, we're continuing to see a fluctuation in the mortality rate for American and Indian Alaska Native residents, but this is very much driven by small population size, and we're considering this to be in decline as well. The next slide provides information looking at mortality by Hispanic ethnicity status. Deaths per million continue to decrease for Hispanic, Latino, and non-Hispanic Latino residents. There were fewer Hispanic Latino deaths per million in this graphic than non-Hispanic Latino, but it's important to understand for this population that these are not age-adjusted rates. Next slide, please. We've been asked about how our ranking of mortality compared to other states changed over time. So this is a graphic that is showing you what our rank was relative to other states for deaths per 100,000 population from March onward. If the number goes up in ranking, that means we are seeing fewer deaths compared to other states. If the number comes down, we are seeing more deaths compared to other states. So that was a request we had. We thought we'd just make this available to you so you could see it as well. You can see that our ranking compared to other states was, we had fewer deaths compared to other states during the summer. We saw increase in the number of deaths compared to other states throughout the fall. And now we're seeing, again, a decrease in the number of deaths in Michigan compared to other states. Next slide, please. So now we're going to do a quick check-in on how we're doing for public health capacity. Our testing volume has increased. 14.9% of diagnostic tests reported to the State Health Department now are antigen tests. And our testing rate ranges from at the county level from 2,000 tests per million people to 7,000 tests per million people. Our case investigation rates are improving after the holiday decline. However, we're still seeing a very consistent proportion of cases who report knowing where they may have become infected with COVID-19, and a consistently low portion of cases who report that they were in quarantine when their symptoms began. And both of these numbers we want to see increase. The first indicator is telling me that we are still seeing community spread in the state. And the second indicator is telling me that people are still having the potential of infecting others at the time that they become ill. So, but first, in the next slide, let's talk a little bit about testing. This provides you some granular information about our use of PCR tests and antigen tests in the state. Our rolling 7-day average went up 11,000 tests based on the week period that we look at through this dashboard. The positivity among the antigen tests is about 3.5%. Next slide, please. This is looking at, you can see the increase in diagnostic tests over the last couple of weeks. Just a reminder that stacked bar, the blue portion of that stacked bar is telling you what percentage of what the total number of antigen tests that were reported to the State Health Department. Next slide, please. So the week of January 9th to January 15th, there were over 12,000 cases reported to the State Health Department or referred to state and local health departments for investigation. 76% of those cases had a completed interview that week. Of those 9,000 people who were interviewed, 43% reported having a known source of infection, and 26% reported that they were quarantining before symptoms began. Next slide, please. So moving on to some information about some recent serology results that the Centers for Disease Control and Prevention provided, as well as COVID-19 vaccine update. So there were data that CDC just recently put out regarding seroprevalence in each state through November. For Michigan, our seroprevalence was 8.8%. So it's probably higher than that by now. But what this means is that in November, about 8.8% of Michiganders are expected to have been infected by the virus or have evidence that they were infected by the virus. More individuals are likely to have been infected than have been identified through our disease surveillance and reporting. Individuals who are not identified under disease surveillance and reporting may have been asymptomatic or may have never received medical care and a test for COVID-19. What we see in these data is that younger age is associated with a higher seroprevalence, and that Michigan fared relatively better than some of our neighboring states in terms of the percentage of people shown to have been infected by the virus. In terms of COVID-19 vaccination, 5.4% of Michiganders have had their first dose of vaccine to date. That's up from 3.2% last week. And there were more than 500,000 doses reported to the state of Michigan, including 437,000 first doses and more than 75,000 second doses. So let's get into some detail around the serology results in the next slide. This map is giving you the estimated prevalence of antibody seroprevalence. So this is the proportion of individuals who have ever been infected with SARS-CoV-2 as measured by the antibodies that are present in blood samples. Despite the surge of cases in Michigan early in the month of November, our seroprevalence was still lower than that of our neighboring states. We were at 8.8% in November. Wisconsin was at 15.6%. Illinois was about 16%. And Ohio was 13%. Next slide, please. So 8.8% of Michiganders equates to more than 870,000 people having ever been infected with SARS-CoV-2 based on commercial laboratory testing. At the same time, Michigan had identified more than 413,000 cases. And again, we're going to have this difference between people infected versus number of cases identified, because some people will be asymptomatic or others may not have sought medical care and been tested for COVID-19. Then the last graphic in this series, in the next slide, is giving you the age and sex distribution of these seroprevalence estimates for the state. These graphics are showing you that individuals are more likely to be infected with SARS-CoV-2 if they're younger or if they are female. So let's move now in the next slide to talking about our number of COVID-19 vaccine doses that have been shipped and administered. As of January 17th, we had more than 1,600 providers in the state who were enrolled in the federal COVID vaccination program. By the 19th of January, there were more than 1 million doses that had been shipped to either Michigan providers enrolled in the program or through the federal long-term care pharmacy partnership program. By January 18th, we had more 512,000 doses reported back to us as having been administered. And our first dose coverage, meaning the percentage of Michiganders age 16 and over who had received a first dose, is now at 5.4%. The next slide is providing a graphic, which has now been updated on our dashboard. But just want to remind folks that you can go to our dashboard and see the number of doses that have been provided, both first and second dose by day, by administration date. And if this was updated with yesterday's graphic, you would see that we had more than 21,000 doses administered on the holiday this week. And then the last graphic in the vaccine series here is giving you some information about where we stand with the long-term care federal partnership. Since starting on September 28th, CVS and Walgreens partners have vaccinated more than 34,000 skilled nursing facility residents and staff, reaching more than 85% of those facilities with the first dose. They've also since January 4th, also been providing first doses to staff and residents in 582 other long-term care facilities for a total of more than 56,700 staff and residents in long-term care facilities throughout the state having received a first dose of vaccine. And CVS and Walgreens are reporting more than 650 facilities that will have a vaccine clinic over the next 7 days. So the last set of information I have for you is what we refer to as our science roundup. And we wanted to share some of this with you today, specifically around the identification of the B117 variant. So there was a individual sample from Washtenaw County that we've identified the B117 variant. We expect to see this variant elsewhere in the state as well. This variant is not expected to impact the effectiveness of COVID-19 vaccination, but it does allow the virus to be transmitted more easily between humans. So we may see the case rates increase. It also has implications about herd immunity. If a virus is more easily transmitted between humans, we have to have a higher number of, or a higher percentage of humans vaccinated in a population to disrupt transmission. Masking, social distancing, and hand washing continue to be crucial in response to this variant, as they are with other forms of the SARS-CoV-2 virus, but they are particularly important in order to stop transmission. And we will also be providing you information about our mobility update. The most recent data shows a return to more baseline mobility activities, particularly for non-essential visits. So let's get into some detail about the SARS-CoV-2 genetics. In the next slide. I want to want to make sure I'm citing the Michigan Department of Health and Human Services Bureau of Laboratories. This is their slide, and they have had a, they're one of the leaders in terms of state public health departments in having advanced molecular diagnostics. And in this case, we're able to apply it to SARS-CoV-2 genetics. So I wanted to try and provide sort of one summary slide about how viruses infect human cells and how this mutations may occur within the population of viruses. So mutations are expected to occur in viruses. It's part of any virus's pathway. Some of those mutations will result in a non-functional virus and they will disappear. Some of those mutations may result in a change in the virus. Most frequently, that change may make it more transmissible. So viruses will infect human cells. They'll cause the cell to replicate itself. And in that replication, that's where some of these mutations occur. The B117 variant was first identified in the United Kingdom and has now been found in most of the United States. Right now, evidence does not give indication that it's going to impact vaccination or treatment options, but we do know that it has increased ability to transmit between people. Next slide, please. So I wanted to find a way to describe what that increased transmission may mean in terms of our case rates. So the top graphic here, and I wanted to thank the University of Michigan School of Public Health for providing this graphic. The top graphic here is giving you our RT rate over time throughout the epidemic. Most recently, we've been able to drive that reproduction rate below 1. So we've been at 0.9, which is great. It means that our case rates are going to continue to decline if we're able to keep that RT rate low. Data out of the United Kingdom suggests that the RT rate for the B117 variant is 1.5 times higher than that for other forms of the virus. And so you can see the dashed line in that top graphic is giving you an idea of if Michigan's only had the B117 variant in the state, how much higher our RT rate would be. Going to the bottom graphic, you're seeing our daily cases, as well as our sort of the trend over time in that case rate. And as an epidemiologist, this variant does give me cause for concern, because as that variant becomes more prevalent within the population, we're going to see, instead of being able to maintain that dark line decline, unfortunately, we may see that we're going to have that increasing orange line will be our case trajectory. So again, it is crucially important that we continue to use masks, that we continue social distancing, and that we continue hand hygiene and other efforts to mitigate exposures. Next slide, please. All right, I want to do a little bit of look back. So earlier in the year, we had been looking at this COVID SIM model. And back in November, we had looked at where we could go before we put the pause to save lives in. So the left-hand graphic is showing you the dark part of that line is showing you what we had observed up to that date of COVID-19 cases. And then the gray is showing you the projections that these models were giving if we had continued where we were at that point. The graphic to the right with the blue dots on it is giving you where we have come since then. So those blue dots are the number of cases that are, I'm sorry, these are mortality, my apologies, the number of deaths that we're reporting each day. So you can see that the number of deaths have been increasing up through November, we put pause in place, deaths continued to increase to the beginning of December, and then we saw them beginning to decline and continuing to decline. So although the COVID SIM model had projected a daily death range of a peak of up to 250 deaths, we actually had our peak at 150 deaths in a day. Next slide, please. Okay, so just finishing up really briefly with our mobility patterns. These are the unicast data that have been updated through January 14th. And for all three of these measures of mobility, you can see that we've started, that line at the very end has started to uptick again. The higher that line goes towards zero, the more we're getting back to our more usual patterns of mobility that we had before the pandemic. So again, we want to encourage people to maintain social distancing, to try and eliminate trips that are unnecessary, so that we can prevent any unnecessary exposures to potential COVID-19. Great. Thank you very much for your attention. I believe that is my last slide.
Thank you very much, Dr. Lancallo. If you would like to ask a question, please raise your hand. We will be limiting everyone to one question. We have a short period of time and several of you available. Robin Erb, please unmute yourself and ask your question. Please also make sure you announce your name and the publication you are with. Thank you.
Morning, Robin Erb with Bridge. Sarah, you mentioned the need for more vaccination coverage against, the new variant. Is there a new goal in mind? The previous goal was 70% of 16 and older. Is there a new goal in mind?
So I think a lot of that is still being understood. We have been playing with some sort of illustrative models. So I think there's still a lot more work that needs to be done to understand exactly how that virus spreads in Michigan and the United States. We're anticipating that we may need to be, closer to 90% or perhaps over 90%.
Thanks so much.
Okay, next up, Kelly Rainey, please unmute yourself and ask your question.
Hello, Callie Rainey with News Channel 3. Yesterday we heard Whitmer speaking and just kind of wanting to figure out how would freeing up state money speed up vaccine distribution?
So I'm here to present a data update. I don't know if there's anyone else on the call that would like to take that question or if we should get back to you.
Hi, this is Dr. Caldoun. I just joined. So absolutely more funding is important for our vaccination efforts. Funding would be going towards, for example, mobile vans that could go into communities to vaccinate the most vulnerable. It would add additional staff, for example, to be able to vaccinate more people. It would pay for facilities for mass vaccination sites. So there are many things that this funding would do to augment our vaccination efforts. I will say, though, the most important thing that we need right now are more vaccines in the state of Michigan.
Thank you. Kyle Mitchell, can you unmute yourself and ask your question, please?
Hello, Kyle Mitchell with Wood TV, based out of our Kalamazoo office. I'm not sure who the best person to answer this, perhaps Dr. Caldoun. My question is about the Moderna vaccine shipment that possibly was spoiled. I know it's being held and kind of looked at this point. Any indication of what might have caused that? Is that a setback in terms of the total vaccinations that can be done in this state? I mean, is this something the state is looking closely at?
Yes, I can take that. This is something that is on the manufacturer, McKesson, as far as the reason. They have not told us exactly why this happened, but we are following up closely with them to understand what it did and try to prevent it from happening again. But again, this is not the fault of any provider or the state of Michigan. This is something that we believe happened at the manufacturer level at the time of shipment. We have received additional replacement doses, so it does not impact the amount of vaccines available to the state of Michigan. We quickly identified the issue over the weekend and they immediately shipped out replacement doses.
Okay, thank you. Mike Wilkinson, please unmute yourself and ask your question.
Hi, Dr. Lancallo. With the numbers that we've talked about for a long time about the restrictions and the pause to save lives being hospitalizations, testing, and case rates, Michigan obviously is in a much better position than it was before. I'm wondering if you're recommending that the administration relax those restrictions on the restaurant industry before February 1st or on February 1st, or if there's any fear that doing that early might signal to people that the fears of the coronavirus have diminished and people might let their guard down. One, are you recommending that they relax before or on the first? And then secondly, has restaurants becomes kind of symbolic of something more than just what they are?
Hey, this is Robert Gordon. I'm happy to take that question. I think the governor has said, and we said last week, that the plan was, if trends continued in the same direction, to allow for the reopening of indoor dining on February 1st. I think the trends have continued, and that continues to be the plan right now. The state has gained tremendously because of the pause and because of the significant reductions in case levels, in positivity and hospitalizations. And so the date remains February 1st. And I think, as you allude to in the second part of the question, while restaurants will be reopening on that date, there will continue to be risk associated with indoor dining, and we will be talking about that more on Friday.
Thank you. Julie Mack, can you unmute yourself and ask your question?
Thank you. This is Julie Mack from MLive. And my question is about vaccine supply. How much are we getting a week, like this week, for instance, and how much are we actually requesting in the state of Michigan?
So we are requesting all the doses that are available to us each week. The Centers for Disease Control and Prevention has been providing fairly steady level of vaccine. I want to be clear that we're provided information about how much vaccine we may be receiving sometime during Tuesdays, but then that number really doesn't become final until Thursdays when we're putting our orders in. So, we're around 120,000 doses, but I just want to be clear that those numbers will change.
I mean, how much would you like to, if, you're saying you'd like to have more? I mean, what would be, in an ideal world, if supplies were unlimited, what would you be seeking?
So I'm sorry for some background noise here. We've made plans for 50,000 doses a day. Obviously, we would like to be able to vaccinate as rapidly as possible. The more vaccine we have, the more that we will, the more quickly we'll move to get that out the door and into people's arms.
Thank you. Last question, Kristen Seamus.
Hi, Kristen Seamus from the Detroit Free Press. I'm wondering, now that we know that we have the B117 variant circulating in Michigan, I'm wondering if you can talk at all about whether we are likely to see public health orders in the future as this form of the virus spreads, to restrict some action to try to limit the spread, and at what threshold would those new restrictions be triggered?
I can take that. I think, we have always said that we look at multiple factors, and I think we will continue to do that. So as in the past, there aren't numerical, there's no cookbook for identifying when to move, but I will say, obviously, we are very concerned about the variant, and so we will be observing trends as we move forward.
Okay, thank you all very much. I appreciate Dr. Lancello making this presentation, the Director Gordon and Dr. Khaldun also joining to help answer questions. Thank you.